Dr. Lee Weiss. Good morning, Doctor.
Good morning. Pleasure to be with you.
I want to thank you for taking our call this morning and bringing us the information. We were talking with Lisa and also Mike from Maui Health. Dr. Lee Weiss, how many years of experience do you have, Doctor?
40.
40 years. I assume you're 42 years old, right, Dr. Lee?
Yes, I'm just an infant.
Awesome. Well, let's get right to the questions. We want to thank all of our listeners for submitting their questions. This is the first one coming from Carl from Pukalani. Lee, where are the new cases coming from? And are they still mostly arrivals from the mainland? Or are we now seeing community spread, like from local stores or contact in the local areas?
Well, right now we're not seeing much of either. Last count that we had was approximately 25 cases on the island of Maui. None of them hospitalized, none of them sick. More than 50% of those are no longer in quarantine, meaning they're over their disease. I don't want to say we've dodged a bullet because there's still plenty of bullets in the air. But compared to Los Angeles as an example, or New York City, or even some of the cities that are lesser impacted, Maui is very mildly impacted at this point. But make no mistake about it, this is nothing to take for granted. We are taking this very, very seriously and making all of the preparations that you're seeing elsewhere, preparing our intensive care units, our critical care units, our emergency department, our general medicine units, all of our outpatient areas, designing a system so that the hospital does not become a contaminated zone, doing triage outside the hospital, and building teams to deal with a surge if it ever materializes.
Awesome.
But the answer to our friend from Pukalani is, for right now, we're not seeing much in the way of new cases, and we're certainly not seeing much come from tourism because tourism is all but not there any longer. And so any new cases we see presumably would be from community spread. But again, we're just not seeing a lot of cases at this junction.
Thank you. All right, next question. Will warm weather stop the outbreak of COVID-19 as rumors has been spread?
Again, a very, very good question. And if we were to compare the novel COVID-19 with other coronaviruses, there are about 6,700 coronaviruses that have been identified that affect humans. The common cold, by the way, is a coronavirus. This is a novel coronavirus. And the reason it's a novel coronavirus is it didn't originate in humans. It jumped from an animal or a zoonotic, became a zoonotic infection where it jumped from an animal to humans. That's a very unusual circumstance. This happened, and now, of course, we have a pandemic. I don't know whether that answers the question or not, but that's what we know right now.
That was very helpful. Very helpful, Dr. Weiss. Okay, next question. This is coming from one of our listeners. Actually, just came in this morning. Is older people more susceptible of catching the COVID-19 virus?
Not only are we more susceptible to catching it, and you notice I said we, because I'm certainly in that senior category. Seniors' immune system works differently, and the most important thing about seniors is they tend to be individuals who have chronic ailments. They've lived a long time. They typically have the chronic ailments of our society, meaning high blood pressure, heart disease, lung disease, diabetes. Not only do these individuals have immune systems that may not be as robust, when they do become infected, they have a more problematic course. These are the individuals who tend to have problems that lead to intubation and the need for ventilators, respiratory support, and ICU care. That doesn't mean young people are out of the woods. We know, for instance, that people under the age of 20 infrequently present sick, needing to be hospitalized. Infrequently, not never, but infrequently. But they tend to be the asymptomatic viral shedders that seem to be spreading the disease in an unknown manner because they're asymptomatic.
Wow.
So no one group follows any one pattern, but in general, those among us who are at greatest risk are those greater than the age of 65 with comorbid disease, other chronic medical conditions.
Interesting. Dr. Weiss, is it okay to walk for exercise, and would you recommend wearing a mask?
So I split my time between managing practices on the island of Maui and Los Angeles. And I say that because California has just passed a rule that everyone should be wearing a mask. Why did they pass that rule? They passed that rule because there's new evidence that suggests that the virus is in small droplets of exhaled air when people speak or breathe. And so it is conceivable that you walk into a room where another person had been talking, even 10 minutes afterwards, and you walk through sort of a mist cloud, and you can become infected this way.
Wow.
So California just passed a controversial law where everybody who's out in public will be wearing a face mask. Not an N95 mask, not a surgical face mask. Sometimes akin to a bandana would be something that they're recommending. All of this is brand new as of today. What would I say to people on Maui? I would say to people on Maui that the population density is lower, and that if you're going to be out and about for a walk, you're not going to a store to shop, etc., I think that you don't need a mask.
Okay.
But if you're going to be in and around other people, perhaps shopping in a supermarket, perhaps waiting online at SSI or the Social Security office or things of that, I think that there might be some benefit to it. But again, the jury is out, and that's what's so frustrating here. We don't know all of the answers, and an ounce of prevention is worth a lot of good.
Yeah.
But we're not talking about surgical masks. We're not talking about N95s. A, those are all but not available. B, it would be terrible overkill, and you'd be using a product, literally taking it out of the hands of healthcare providers who need them desperately. I think an ounce of prevention is important, meaning don't be out and about if you don't need to be. A little walk outside, a 20-minute walk outside, a 30-minute walk outside by yourself, not in crowds, keeping strong social distancing. I use the number 20 feet. Some people use the number 6 feet. Some people use the number 25 feet because a sneeze carries droplet particles farther than a cough. And so I believe in a little bit of more distance in social distancing. And I think all of those things add up to good personal responsibility. Good personal responsibility, take care of yourself, get enough rest, drink lots of fluids, make sure you're paying attention to your own health care, eat properly. If you're a smoker, decrease the amount you smoke. And if you develop symptoms, call your provider. Don't rush to the emergency department.
That's awesome. Dr. Lee Weiss on our radio show this morning. I definitely look forward to talking with you again, Lee, because we're out of questions for you today. But thank you so much. That was very, very useful information. A lot of the questions were answered even along the way. So want to thank you in the Maui
I'm very
Health.
happy to help you. I very much appreciate the opportunity to be with you today. My message to the residents of Maui is, your emergency department stands ready to help you. We're there 24/7. Dedicated people in that hospital, nurses, doctors, technicians, secretaries, housekeepers, all of them fighting a very strong fight. Say thank you a little bit. They're really putting their lives on the line.
Yeah.
I thank them every day. And thank you for bringing this message to the public. Everybody's scared, and knowledge is king.